Okay. My name is Karl Blum. I'm an orthopedist. My office is in Toms River, New Jersey. I'm affiliated with Ocean Medical Center. I did orthopedic training in New York at State University in New York, and I did subspecialty training in sports-related injuries in Cincinnati. When I first came to town, as I'm building a practice, I was a sports-trained doctor, but I'm also a general orthopedic, so I would see the seniors that would come in, and if you know anything about our area here around Toms River and Brick area, we are surrounded by retirement villages, so I do see a lot of seniors. And one of the most common things we do with seniors is we do joint replacements. So I do a high volume of total knee replacements and total hip replacements. And luckily the results are terrific. You can sometimes change people's lives by doing a joint replacement. And I think it impacts, as people get older, mobility is probably one of the most important things that impacts their lives. A lot of times I've had patients come in and say, "Doctor, I came for a second opinion. My other doctor said I need to have a total knee replacement." And I would say, "Are you ready for a total knee replacement?" Because there seems to be a process that everybody goes through. The first time you have knee pain, we don't jump in and do a knee replacement. Usually we'll give you an Advil, or maybe we'll try an ice bag or send you to therapy. Sometimes we can get away with very small surgeries where we can put an arthroscope in your knee and maybe trim something or smooth something. And then maybe we'll try injections. You know, we use cortisone type medicines. We also use hyaluronic acid, which is a lubricant. So along this process, somebody might go years before they get to the point where they say, "Doctor, I'm getting disabled." So it's kind of a personal choice. The success rate of total knees is about 95% of people will say, "I'm happy I did it." That means we classify them as good or excellent, a little bit higher with hip replacements. One of the best parts about taking care of the patients is when somebody comes back to me after a surgery or after a treatment and they say, "Thanks, Doc, I'm doing great." I've actually had, in the last year, 2 patients walk into my office and say that I gave them their life back, which is the greatest payment you can get.